Okay, so if you're studying to be a manual therapist, you already know palpation is, well, it's everything, right? It's really the skill that separates just guessing from truly knowing what's going on. I want you to think of the human body as this incredibly detailed map. Your job is to learn how to read that map, not with your eyes, but with your hands. So let's get into it.
It just feels like a lot, doesn't it? I mean, you've got these anatomy charts, you've got heavy textbooks, and then you have a real live person on the table in front of you. And that gap between the book and the body can seem massive. But look, don't worry. Every single expert started out exactly where you are right now. The secret is learning to find your landmarks.
And this is why we're hammering this home right from the get-go. Mastering palpation is absolutely the bedrock of your entire practice. It's what's going to let you assess things accurately, treat effectively, and, most importantly, keep your clients safe. It's that fundamental.
So what are we actually looking for? We're searching for bony landmarks. Think of these as the big "you are here" signs on the body's map. They are these consistent, solid points that you can feel, and they guide you to everything else, all the muscles, the nerves, the joints. They basically give you the coordinates for all of your work.
So in this explainer, we're going to take a really systematic tour of the body. We'll kick things off at the head, move down the torso, explore the arms and legs, and then we'll wrap up by putting it all together. By the end of this, you're going to have a clear, functional map to guide your hands. All right, let's start at the top, at the command center, the head and neck. The landmarks here are so important, especially when you're treating really common stuff like tension headaches or TMJ issues. Nailing these points is truly the first step to figuring out what's going on in this super complex area.
Let's start with a few prominent points you can probably feel on yourself right now. Go to the back of your skull, feel for that really distinct bump back there. That's the external occipital protuberance, or EOP for short. Now find that bony point right behind your earlobe. That's your mastoid process. And from there, you can actually trace your zygomatic arch forward, right along your cheekbone. These points are critical anchors for some major head and neck muscles.
Okay, so let's move from the skull down into the neck. Now this is where things get really interesting and where we learn a super important clinical lesson. What you read in a textbook is not always what you're going to find on the table.
Okay, so listen to this, because this is huge. We're all taught that C7 is the most prominent spinous process you feel at the base of the neck. But in the real world, for a lot of people, that big bump could actually be C6 or even T1 from the thoracic spine. And that old trick where you have the client extend their neck to feel C7 disappear? Yeah, that's not a foolproof rule. So what's the big takeaway here? Never, ever rely on just a single test. You have to cross-reference with other landmarks to be sure.
Let's move on down to the central pillar of the body. The landmarks on the thoracic cage are absolutely essential for things like postural analysis and checking out someone's breathing patterns. They really do form the core of our skeleton.
You can trace these super easily on yourself. Start at that U-shaped dip at the top of your sternum. That's the jugular notch. Now, slide your finger down until you feel a little ridge. That's the sternal angle, and it's a key locator for finding the second rib. Keep going down to the pointy bit at the bottom, the xiphoid process. Then feel around on your sides for ribs 11 and 12, your floating ribs. They're really important to locate when you're working on muscles like the diaphragm.
Now, let's branch out to the upper limbs. Honestly, getting a solid handle on the shoulder girdle and arm landmarks is totally non-negotiable. You need this to understand upper body mechanics and to treat everything from shoulder impingement to wrist pain.
The scapula, the shoulder blade, is just loaded with key palpation points. Here's a great tip. To make the medial border and the inferior angle way easier to find, just have your client place their hand in the small of their back. You'll feel it just pop right out for you. From there, you can trace the spine of the scapula all the way out to the acromion, which is that high point of the shoulder.
And this right here perfectly shows the direct link between a piece of anatomy and a common injury. When you feel for the epicondyles on either side of the elbow, you're not just finding a bit of bone. No way. You are literally touching the origin point for the very muscles involved in golfers and tennis elbow. Knowing this completely changes how you approach your treatment.
Now, for a really practical tip, finding the radial head can be a little tricky because it's designed to move. So here's exactly how you find it. First, locate that lateral epicondyle. Then, slide your finger just a little bit down, distally, into the soft spot. Now gently rotate the client's forearm back and forth. You'll feel that little disc-shaped head of the radius just spinning right under your finger. It's a fantastic little trick to confirm you're in exactly the right spot.
All right, let's head down to the foundation of the body, the landmarks of the pelvis and the lower limbs.
These are going to be your go-to guides for gait analysis, checking hip alignment, and a whole bunch of issues that can stem from the low back all the way down to the feet.
The pelvis has some of the clearest landmarks on the whole body. Go ahead and find those 2 bony points at the very front of your hips. That's your ASIS. From there, you can trace the top of your hip bone, the iliac crest, all the way to the back, where you'll find the PSIS. Those are often marked by those 2 little dimples in the low back. These points are what you'll use to assess pelvic tilt. And that big bump on the side of your hip, that's the greater trochanter, a key attachment site for your powerful glute muscles.
And here is another absolutely critical connection for you. The ischial tuberosity, which we all know is our sitting bone, is the main attachment point for the hamstrings. So when a client comes in with pain high up in the back of their thigh, this is a landmark you have to be able to assess with total precision.
And to finish our tour, let's go down the rest of the leg. So below the obvious kneecap, or patella, you'll feel the tibial tuberosity. That can be a common spot for pain, especially in young athletes. On the outside of the knee, find the head of the fibula. That's a key landmark to be aware of to avoid a nerve that runs nearby. Then, down at the ankle, you have your big ankle bones, the malleoli. And finally, the large calcaneus tuberosity, your heel bone, which is the main attachment for your calf muscles.
So, there we have it. We've journeyed from the top of the skull all the way down to the heel. But what does all of this actually mean for you as a student trying to learn all this?
Well, it means you're not just guessing anymore. This knowledge literally takes anatomy out of the pages of a book and puts it directly under your fingertips. The body stops being this abstract concept and it becomes a real, tangible, and navigable map. These landmarks are your guideposts. They're what will make you a confident, precise, and truly effective therapist.
So, you have the map in your hands now. The only thing left is to actually start exploring. I want you to pick one area, any area we just talked about, and just practice. Practice finding those landmarks on yourself or on a friend. So the question is, which one are you going to explore first?